Our focus today is JupyterHealth, an open modular platform extending the Jupyter ecosystem into the regulated healthcare environment. What JupyterHealth does is it creates a secure, reproducible pipeline for wearables directly into EHR integrated environments. We are joined by the primary architects of this infrastructure, Ida Sim, professor of medicine at UCSF, member of the National Academy of Medicine. She co-founded Open mHealth and Vivly and has essentially spent her whole career defining the standards for global health data sharing. We also have JP Pollack, chief architect of the Commons Project and a senior researcher in residence at Cornell Tech. He co-led the development of the smart health cards and focuses on the user side collection and utilization of real-world data. Ida, JP, the floor is yours.
Wonderful, Vivek. Thank you so much. It's really a pleasure to have this opportunity to present to you JupyterHealth and to be part of this webinar series. So next, we've all heard about precision medicine. It's been like several decades now. I think that's been a term that's really animated much of biomedicine and clinical care. I'd like to offer an operational definition of precision medicine. And this is speaking from my perspective as a primary care physician, and also, of course, all of us are patients as well, right? So precision medicine, what if each of us, every patient, each of us could get the best proactive care and self-care we need based on complete data and knowledge for our specific mix of conditions at any particular time within the context of our clinical and our life situation, right? That's, if I could get this for my patients, if I could get this for myself, that would be wonderful. I would ask that you note here that there is no mention of omics. There's no mention of our genes or SNPs or whatever, and there's no mention of AI, right? It is the operational definition is where we would want to go, not how we would get there or what tools. Next slide. So in that context, we really do have to start with what is the experience of health and healthcare today, and I would constrain my remarks to the US. The burden of chronic disease is extremely high in the US. 3 out of 4 Americans have at least one chronic disease, which is one of those 7 conditions listed on the bottom. And over half of American adults have 2 or more of the 7 diseases listed below. I take these data from the CDC, and just a scant 2 years ago, it was only 60% of Americans have at least one chronic disease, and over 40% have 2 or more. So we're already worse than we were 2 years ago by the data from the CDC. Next slide. This is an implication not just for the morbidity that we have in our population, but 90% of the close to $5 trillion that we spend annually on healthcare comes from these chronic diseases. Next slide. Now, chronic diseases, of course, happen 24/7 out where we live and play. They do not happen in an academic medical center like UCSF. This is a fascinating paper from Larry Green in 2001, a reprise of an earlier article he had done in the 60s, surprisingly. And in the early 2000s, the numbers were about the same. Now in 2026, I suspect the numbers would be quite different, but the point is probably still true that out of 1,000 persons in an average month, about 800 have symptoms, and you can see the numbers all the way down. I want to call your attention to that it's a minority of people who visit a physician's office, about 200 out of 1,000. Around 13 visit an emergency room, 8 are hospitalized, and fewer than 1 in an academic medical center. So think about that. Most of you are attached in some ways to a university, to an academic medical center. We look at electronic health records. That's really just the very far bottom right. I like it to looking through a pinhole camera. And we're missing a lot. In fact, the healthcare systems, this blue box, really isn't the whole picture. Next slide. The whole picture is what happens outside of healthcare, where those chronic diseases live out in the orange. Next slide. And so the opportunity that is afforded to us is to access that experience, that life happening outside of the healthcare system. And of course, digital monitoring is one of the major tools here. Patient-generated data, this includes both patient-reported outcomes, so qualitative, subjective data, and also the quantitative, physiologic data that I'm sure we're all familiar with, the glucometry CGMs, the Oura Watch, the Oura, Apple Watch, and so forth. So of course, huge promise, tons and tons of money pouring into it. And where we are today, next thing is 1,000 flowers blooming. This has been the case for years now. It's wonderful. Just before we got on live here, Shaheen was mentioning his allergies. That's what happens when you have 1,000 flowers blooming, right? A lot of allergies. next action, please. What we really want isn't just a whole bunch of flowers. We want a nicely arranged set of flowers, right? A bouquet, but not just one bouquet or any bouquet. Next, we want many individualized bouquets that mix and match over time for each of us. Next slide. We want precision bouquets. And as each of us, we're healthy, we get ill, we come back, we might want to get data on our food, our activity, our sleep, our pain. And that's going to vary at different times for different people. And so the solutions that we provide need to be mix and match. And for that, with lower friction, we need modular standard space. We need composable solutions, and that's not where we are now, of course. And our answer here is JupyterHealth. Next slide. So just to recap the problem, I'm sure you're well aware, right? We operate in silos, our workflows are inefficient, we're reactive, not proactive, and a tremendous amount of friction in building the kinds of solutions that we need. And I would say this market failure, the solutions are not the ones that we need. The opportunity, obviously, is real-time data integration, as little friction as possible. And our postulate is that a unified platform that is purpose-built for the problem, as we've stated, is what's needed. And that an open source platform would leverage the power of open source and open communities to create this better, faster transformation. Next slide. So going back to our metaphor, if I don't torture it too much, we want to enable florists at scale, right? To take our current state, which is piecemeal and siloed, and offer this open source modular platform to get us to precision bouquets. Next slide. We have put together just an absolutely amazing team. This is a project out of Berkeley, UCSF. We have JP, whom you'll hear from very shortly from the Commons Project. Fernando Perez is the founder of Project Jupyter. So Fernando and I connected some years ago, and I said, we really need Jupyter for 20% of GDP. That's healthcare. And you see that we have, a great software development team. We're very, very tightly tied into clinical operations and research, as you will see very soon. And the project groups include, of course, Berkeley, Commons Project, UCSF, 2I2C, which supports Project Jupyter, and then Duke as well. Next slide. So just briefly, the ecosystem overview that the JupyterHealth platform, and JP will go into that, is the bottom, is the horizontal, it's the foundation. And it addresses some of the really big pain points that we have observed over our decades of work in this field, right? It's a privacy-preserving acquisition of personal data, which is real time and streaming from sensors, but also EHR data. How to ingest it, how to standardize it, and we all know that the semantics in healthcare is very challenging, but also very necessary. Storage and management, authentication access, you can imagine the kinds of pipelines that are needed. Presentation, there's a lot of tools in the Jupyter ecosystem that we could reuse. There's a lot of work that's already done. And then the interface is critical that it interfaces into the operational healthcare world and also out to patients themselves, back out, beyond the walls of the clinic and the hospital. Many of you are probably seeing, aha, that's where FHIR fits, that's where Smart on FHIR fits, and indeed you'll hear about that. On top of this horizontal, there are vertical solutions. These are some early adopters ranging from UCSF and Duke onto some commercial companies like mHealth and others, really addressing a range of use cases, primarily right now in sort of some of the big chronic diseases that you can imagine, hypertension, diabetes, heart failure, and so forth. But of course, it's the dot in the middle that's important. People can build with it what they want. And we certainly want to have this community engage with JupyterHealth, use it, build on top of it, join the community and push the work forward for the sort of precision medicine vision that I think we'd all like to get to. I'll turn it over to JP now if there are any questions, and I don't see any in the Q&A, but we can move on if there aren't any. Okay, JP, go ahead.
Great, thanks so much, Ida. Okay, so as Ida described, JupyterHealth is a platform that assists in a variety of different aspects of this notion of combining patient-generated data with data from the clinical domain, either for research or care. And so this is, one of those classic sort of spaghetti architecture diagrams that maybe the first time you see it doesn't make a whole lot of sense. But as we talk through some of the various components, hopefully, this will all become a little bit clearer. For those of you who are, familiar with the way that clinical ops works and the way that some of these kinds of projects works, maybe this is a little bit more familiar to other diagrams that you've maybe seen from your organization or others. Basically, we're trying to convey with this that JupyterHealth fits as a platform into a few different contexts and provides you with the tools needed to make some of that happen. So, on the left, we have the domain of clinical research. Here, we're talking about the kinds of research that might involve things like digital biomarker development. It could, involve the early exploration of new prototype wearable devices or mobile applications. Generally, think of this as the sort of stuff that you might do by combining data from the clinical record with data from wearables or other patient-generated data, as well as, of course, potentially external large data sets. On the right, we have consumer health applications. There's a whole wealth of consumer applications out there, more and more every day. From this perspective, really the JupyterHealth platform is about empowering people with their own data, either for themselves or via the applications that they download, subscribe to, prefer to use. And last, the healthcare system. I think Ida's done a perfect job summarizing where we think JupyterHealth fits in that context, so I won't dwell too much. But in the center, we have the JupyterHealth platform. So there are modules for data acquisition. There's something that we call the JupyterHealth Exchange, which manages all of the sort of nitty-gritty of management and access and authentication. There's Jupyter Hub for presentation of data. And then finally, we have sets of APIs to make all of these data available to the kinds of applications where you might want to, in fact, use them. And in the next, sort of 30 minutes or so, I'll talk through some of these components in hopefully enough detail that you can understand how you might be able to use Jupyter in your own work. And then there's a series of demos that we have sort of laced in. I won't be able to go through all of them, but hopefully we'll be able to make this presentation available online afterwards, and you should feel free to click through and watch any of the ones that I skip over or shortchange in the interest of time today. So for the first version of JupyterHealth, we really decided to focus on 4 key components from that architecture diagram. The first is data acquisition. How do we bring data into the JupyterHealth ecosystem? This can happen in a variety of different ways. For the moment, we're focused on patient-generated data and, of course, clinical data, as I described. The second is data management. So we have a set of tools built around a platform called JupyterHealth Exchange that's focused on the secure storage of patient-generated data. You could think about this as a clinical data repository. You could think about it as sort of a Smart on FHIR server. on steroids, mostly focused on things like patient-generated data that come in from outside of the EHR and from outside of the health system. For data analysis, this is where Project Jupyter, of course, really shines as one of the go-to tools for data scientists around the world, ranging from our students at Cornell to senior data scientists at the biggest companies in the world. So here we're really relying on the Jupyter ecosystem with tools from Jupyter Hub and notebooks and beyond. And really, this is intended to be as flexible as possible, so folks can use whichever packages from that domain or beyond as they like. And finally, EHR integration for those projects that move beyond research and into something more operational. This is a challenge that we'll talk about in a bit, but for the most part, our goal here is to make it as easy as possible to translate the work that you've done in a developmental data analysis, data visualization environment into practice. So how can we move basically things from notebooks and Viz into the EHR? We'll start with the focus on the data acquisition side of things. So mostly I'm going to sort of a bit of symmetry here as I talk through these 4 components and try and describe our approach a little bit, talk about a couple of examples and a few technical details where needed. Again, the idea is that hopefully you're able to find enough here that makes sense to you, that you can go sort through our detailed documents and GitHub repos and all of that. So from the perspective of data acquisition, as I mentioned, we're initially focused on patient-generated data. So these are things that, as Ida described earlier, come from either wearables or biosensors, or maybe they come from surveys or symptom reports or mobile applications. Any of the above is sort of fair game for this. We're going to provide some out-of-the-box support for a few devices and applications. By out-of-the-box, I mean we want you to be able to get started working with JupyterHealth, even if you don't necessarily have your own apps and devices or have the tools to build connectivity for apps and devices. So we have a few different pathways for that. The Common Health application on Android devices collects wearables as well as clinical data from thousands and thousands of different endpoints, as well as through the Google Health Connect platform. And then with consent, patients can write those data into your JupyterHealth Exchange instance. We've worked with the folks at Stanford Biodesign with their SPEZI toolkit, which is basically a mobile application framework, which is sort of like the spiritual, not just successor, but improver upon all of the old HealthKit and ResearchKit days. And really the idea here is that it's fairly straightforward to either use example applications or compose your own mobile applications that are then able to contribute data from whether it be surveys or Google's Health Connect or Apple's HealthKit. Really good platform with now connectivity for JupyterHealth. Open Wearables is a new platform that we've discovered that comes out of the EU. And there's a wide variety of connectivity already existing, along with some more robust stuff along the lines of data normalization, deduping, and so on. And we've been working with that team over the last couple of weeks, and in the next few weeks should have JupyterHealth support built for that platform as well. So beyond just the out-of-the-box support, we ideally want this solution to be open and modular and supportive of all of the different kinds of data sources and data feeds that could be out there. So I'll describe in a bit more detail read and write APIs that we have that make it super easy to swap in the applications or wearables or data feeds of your choice, not just the ones that we've provided out of the box. And of course, one of the key aspects of all of this is how we handle the data. This is, a healthcare environment after all, and whether we're talking about IRB protected research or, of course, care, these data need to be treated properly with the correct guardrails around consent. So all of the applications that I described above certainly support the kinds of consent management that we need, as do the other Jupyter components, which I will move into. So one quick example that I wanted to talk about is Common Health and Google Health Connect. So I described above the Common Health application and its connectivity to Google Health Connect. On the right, I won't sort of sit here through the entire demo, but effectively you're seeing the Common Health application and the user is provisioning access to their Bluetooth blood glucose monitors. In this case, I believe it was a Dexcom G7 device. And you can see that there's numerous blood glucose readings have come through. Basically, users receive an invitation link. They follow that invitation link. They consent to participate. And from that point forward, their data get uploaded to a JupyterHealth exchange, where then the data can be accessed and utilized by either researchers or a care team. This is just a quick video showing a Jupyter notebook that's built out an AGP report dashboard. So effectively, you're seeing the data that were collected through that one particular user of mHealth's device. And we can bring those data in and do all sorts of analytics on them and make very rich and robust displays. I will skip over the intricate details of this example, but this uses the SPEZI toolkit from Stanford. A mobile application was built by some of our students at Cornell Tech to record location data over time, to record some data about temperature in an individual's apartment. And the idea was then to compare those data with clinical data, as well as climate data, and finally with data from an Oura ring to begin to understand some of the impacts and potential impacts of extreme heat events, as well as climate generally speaking, on health. Okay, moving on to data management, the second pillar here of our four key tenets of JupyterHealth. And again, for that sort of overview of our approach and thinking here. So again, this centers around a particular set of tools called the JupyterHealth Exchange, which is at its core a Smart on FHIR based clinical data repository. And I'll talk through a few different components of the project. So first, the data model. JupyterHealth Exchange is built explicitly on FHIR and mHealth data, observations in particular, but with support for things like surveys and questionnaires and beyond. And in the fullness of time, we intend to have support for all kinds of different unstructured data as well. For administration, there is in fact a basic user interface that you can use to administer studies, to create and manage the different organizations, provision access, invite patients, all of those things. But really, our admin portal is completely configurable and modifiable. And like everything else, the source code is available should you want to change it, build on it, and so on. And importantly, all of those admin type capabilities are available through API. So if you want to forego the admin portal entirely, build this into a Smart on FHIR application in your EHR or some custom study application that you already use, fully ready to do that. A patient write API, which I'll talk about in a bit of detail in a minute, allows the provision of any kind of application or data feed that you like to provide FHIR and mHealth data into your JupyterHealth Exchange. And lastly, a patient data read API, which mostly comes into play for building things like Smart on FHIR applications that display within the EHR. So the data model of JupyterHealth Exchange is largely built on a FHIR data model. So we have organizations and sub-organizations that come with their own sets of administrative rights and responsibilities. From there, we have studies which can be created on an organizational basis, patients who can be enrolled into studies, as well as the various scopes, importantly, so that different patients in different studies will scope access and requests for different kinds of data. And then, of course, the long lists of observational type data that we can collect for them. We have patients, of course, and then the data are accessible as you back out from these various things based on your permissions to the level that your access and your scopes grant. The administration of the platform, as I mentioned above, is based on a basic Django web application. The application gives you access to all of the different features of the exchange, whether that's defining scopes or selecting sets of wearable devices that you would like to invite patients to contribute data from, or sort of managing who has access to which of the various components. We've built in things like SAML support and other forms of connectivity that make this work within your organization. Certainly, more work can be done there, and as new organizations start utilizing these tools, we're confident that they're going to continue to contribute to make that kind of institutional and more operational build out have more templates and code available for us. The patient data write API, as I mentioned, is a key aspect of this. It's basically just a RESTful FHIR API that supports the contribution of patient-generated data. So data are configured as observations, and then they're uploaded as either mHealth data or FHIR data for the patients that particular mobile device or other kind of application are authorized to contribute data for. Each host institution has an easy set of tools to manage which applications have rights to write to their exchange, which data they're able to write, those kinds of things. The read API works in nearly the exact same way, but again, this is generally speaking going to be used more for internal applications that would like to access the data. But if you recall back to our original diagram, this is in fact the way that we would support a number of different patient-facing applications and patient tools for data access as well. Okay, I'm going to show a quick video here. I think this one is worth it. We have worked with a company that has a mobile phone-based, camera-based blood pressure assessment tool. The company is called CareX, and we've been working with them on a couple of different pilots, and they've been good to integrate their CareX application into JupyterHealth. I should note that the process for them was very quick. Within a couple of days, we had a prototype version of their application that was uploading data into the JupyterHealth ecosystem. And so, we'll spend maybe a couple of minutes looking at these demos because I think it's interesting. And also this is a good chance to see an example of the JupyterHealth Exchange at work. So here in this particular instance of the Exchange, we're seeing an organization called mHealth, and a study administrator is navigating through some of the various components to find a particular patient participating in a particular study and finding an invitation link for them. This invitation link, if you see over on the right on the mobile application side of things, was sent to our user. And here, we have a user gracious enough to allow us to use her likeness in this video, in which the CareX application is now recording blood pressure and vitals. So as the application collects these vitals, you can imagine that this doesn't have to be a blood pressure app. This could be, more or less any application of your choosing. Once the data are done being collected, then the encounter with the patient wraps up, and the data are subsequently sent back to the Exchange. And this is just a quick video showing stepping through where you go and find the demo data, and you can see all of the FHIR and mHealth data for that particular study present. Okay, moving on to the third of our pillars, which is data analysis. So again, data analysis here, we're really relying heavily on the Project Jupyter ecosystem. So, as you would imagine, all of the various benefits and tools available to you through Jupyter Hub, Jupyter Notebooks, publishing tools like Voila, all of that stuff is available to you, and we're allowing you to put it together in a way that's quite customizable, flexible, and of course scalable in the way that Jupyter is. So a few notes on this. We have a special Jupyter Hub that is designed explicitly with sets of modules and pre-configured to work with JupyterHealth Exchange. This is largely so that access to the Exchange via sort of identity management and OAuth protocols are ready out of the box, as well as some tools for importing data through JupyterHealth Exchange's REST API. This particular hub, as do all instances of Jupyter Hub, support the various flexible options for identity management within an institution. If you want your users to simply use their GitHub logins, if you want to create your own logins, or use sort of more robust Active Directory or SAML-based institutional logins, those are supported as well. Jupyter Hub, as many of you probably know, provides a very flexible and customizable environment in which you can use nearly any statistical and analytical and visualization packages that are best suited for your work. You may have tools that you've developed in-house for other kinds of applications and other studies. These should all be reusable within JupyterHealth. And last, and this is something that it has been important to us as researchers and scientists, and is, to be honest, somewhat nascent in the healthcare community, but the work that you do in a Jupyter Health environment, to the extent you want to share things like your notebooks and your analysis and your viz, it's completely shareable within the healthcare community. Some of the folks in Project Jupyter, have strong beliefs and background in publishing, and the idea that notebooks and these kinds of analyses could be suitable for publication in the way that we generally think about papers and journal articles and conference submissions is quite powerful, and to some extent will be a large part of the future for this kind of work. Okay, I'll talk through one example here that's building on one of our prior examples. So, we showed that data visualization from the Common Health application earlier in a very brief setup. So, again, that was Dexcom continuous glucose monitoring data coming in through Common Health and the Google Health Connect pipeline. In this instance, we have a Jupyter Hub that's connected to JupyterHealth to retrieve the data from the device. In real time, the analyses here are, certainly in real time in that they're looking at data that was a snapshot of real, but this is really showing the kinds of things that you can do in terms of notebook composition and data analysis in this environment. And thanks to some wonderful students and team at UC Berkeley for putting this together. And I won't, show the sort of whole 2 minutes of it, but it's certainly available, as is all of the source code for these notebooks on our GitHub as well. So essentially, you're just seeing here, this is the portion of the code that walks through access to data from the JupyterHealth Exchange. So we're finding all of the studies that are available. We're finding the patients that this particular instance of Jupyter Hub and user of Jupyter Hub have access to. And then we're getting into the meat of it and doing all of the calculations for the various glucose metrics. As we continue to move down, we begin to see there's more and more visualizations, which will ultimately display here because this isn't, there we go. In fact, a notebook with live viz that shows up. Okay. The last of our core JupyterHealth components that I wanted to talk about is electronic health record software and platform integration. This is a complex one, as you know. I'm going to talk about some software tools that we have to make this easier. We're all aware, I imagine, of some of the challenges, both technical as well as policy and simply effort-wise involved in getting applications approved for utilization within an operational EHR environment. So recognizing that we're going to make some tools that make some parts of this easier for you, but no guarantees about making anything go faster through your InfoSec reviews or getting time with your EHR team to build these in. But with that, I'm going to talk a little bit about our approach for EHR integration. So one of the key tenets that we're following initially, and that's not to say that it has to work this way forever, but we're taking an approach of data being separate but together. So patient-generated data, external data, even external clinical records that come from the patient will reside in JupyterHealth Exchange, so outside of the EHR, but within the confines of the institution. So, this could be within a particular data lake. This could be, in a firewalled off environment that runs adjacent to the EHR. Lots of different opportunities here, even potentially with some cloud vendor. But key is, not being data in the EHR. Certainly, we can write tools to push data from these visualizations into the EHR, maybe clinical decision support tools in these, in these Smart on FHIR applications will, push recommendations and choices and actions into the EHR. But that's not something that JupyterHealth is focused on at this time. And the main reason being is that we're going for a much lighter touch integration, because that light touch integration allows us to do things that are really flexible, and also scalable from the perspective that we can provide templates and we can provide tooling that can be picked up and moved from one organization to the next, in large part thanks to the federally required standards that exist around Smart on FHIR and EHR API access. So, what we're talking about here really is visualizations and analyses that launch from within the EHR, of course, using Smart App Launch. So things like context about the current patient that you're seeing or the patient roster that are available to you will be available within that application that you're launching. And of course, all of the data that come from the JupyterHealth Exchange are available for those visualizations as well. All of this integration that we're doing, as I've said, is based on the Smart on FHIR standard, which really provides a more than adequate model for connecting these kinds of applications to EHRs. And as I've mentioned, every EHR that's certified in the US for operation is required to operate at least the basic versions of these APIs, and many places around the world support these as well. Okay, so as we think about as we've thought about sort of the how of making it so that it's straightforward to, or at least technically more straightforward to deploy these kinds of tools into the EHR, what is sort of unique about what we're doing in Jupyter? Why is JupyterHealth a helpful platform to make this happen? So as it says here, EHR integration is certainly not going to be easy, but we are going to reduce burden for you as much as possible by removing some of these common kinds of barriers. So first, templates. We have a couple demos available, and soon this summer, as we get underway with some of the deployments live at health systems that were shown in Ida's slide earlier, we're going to have very robust templates available. And what this is essentially, sets of notebooks and Smart on FHIR applications that work with public sandboxes or off-the-shelf open source EHRs such as MedPlum that you can take and pick up and adapt for your own use cases. The next step, which we think is really valuable, is taking a page from some of the tooling that have been created in Jupyter more broadly already, which is essentially tools to turn that very specific and sort of code-intensive notebook style visualization that you've developed, and in a sense publish it in a way that it can much more easily be deployed to an EHR. In the near future, that means we're using some modified versions of tools that exist within the Jupyter ecosystem, like Voila and Binder, to streamline that process, converting something that's in a notebook to an application that's ready to run in the EHR. I'm not going to promise you can push a button and something is deployed in the EHR, at least not in the near term. But what we can do is have a set of prescribed actions and workflows that make it very straightforward to turn that notebook into something that you could, in fact, turn over to a team who's capable of working within the EHR and the Smart on FHIR context and deploy that. In the fullness of time, or potentially in certain environments, we do see that there's a possibility that you could deploy sort of a framework, Smart on FHIR application within your EHR, and publish subcomponents in a more direct way from your development environment into the EHR. Should that be the sort of thing that we can find institutional approvals and workflows for. And finally, the key here is that what we're building is hopefully standardized and repeatable workflows. This means that when you build one application within your institution, hopefully it makes it easier for the next one. This can also mean things like making as a community available to others details about the kinds of tools that you've built, the challenges that you've run up against, and the ways that you worked around them within your own institution, such that we might get to the point where these kinds of applications can be quicker and quicker at our partner and friend institutions as well. Okay, and last thing I'll show here is one example of this working. So this is, again, following this, our CGM example from start to finish. So if you recall, we originally fetched these data from the Common Health application. The data from the Common Health application made their way into the JupyterHealth Exchange, leveraging the Exchange's Write API. And then we developed a notebook, a comprehensive notebook with very detailed and customized visualizations of the CGM data. The last step that we're going to show here is how those visualizations can be transformed and rendered within an EHR as a Smart on FHIR application. This, again, all these this code is available on our GitHub if you would like to check this out and try and reproduce it for yourself. But effectively, we've just leveraged the good parts of Smart App Launch. So, we authenticate and connect to the MedPlum sandbox using Smart on FHIR. We access a MedPlum patient resource, a dashboard is launched, and then that dashboard is pulling data live from the JupyterHealth Exchange. And of course, the visualization is rendered. So here we go, launching into our demo. This is using, again, MedPlum's publicly available EHR sandbox. So what we have here is basically just a quote unquote practitioner, a healthcare provider who's logged into their EHR. They're navigating through and finding a particular patient that they would like to work with today. And here you see them going over to the Apps tab. From the Apps tab, we have our CGM demo application. And so this is now an application that is scoped for access to the EHR. And it is now going and compiling that application because this is, just in MedPlum's public sandbox, not a full integration. But you can imagine steps like this in an actual EHR don't happen. So now we've rendered this window live within the EHR, in the MedPlum EHR. And I'm just going to pause for a second so that you can see that the original patient context, the practitioner, the doctor's name, it's hidden by this little pop-up, but the patient's name, their FHIR ID, et cetera, are all visible, as that was the context that was retrieved from the EHR. And then as we progress, you can see that exact same set of visualizations that we built in the notebook are now available here as this Smart on FHIR application. So, I've now shown you end-to-end how JupyterHealth works to some extent. There's, certainly more to it and we're building, new functionality on a daily basis. But that's kind of the core of it. We hope that Jupyter is today and in the future going to be somewhat different than the sets of tools that exist out there. Certainly if you're a gigantic healthcare system and you have limitless resources and a fantastic in-house IT team, you're able to build up some of these things. You can use, lots of different commercial vendors and cobble together your own system to run this in an operational capacity. But that's simply not scalable, and it makes it really difficult to scale both up and down. If you want to be able to provide access to these kinds of tools for someone doing a 20-person study, and then at the same time onboard a new blood pressure device that you would like to test at scale for evidence generation, it's very difficult in most of those settings to accommodate both of those ends of the spectrum. So we hope the fact that Jupyter is going to provide interoperability across ecosystems, the fact that all of the code here is open source and customizable. Again, a key thing for healthcare folks, like we're talking about the code that's open source and customizable. Of course, these are highly secure systems that get to be built within the confines of your institution. So, like this isn't open data, none of that. We think that this is going to be able to provide, a very robust set of tools that can be used for a wide range of different solutions and different verticals. And the last one, which is just important to us and the ethos of our team, is that all of the stuff that we're building allow for much greater transparency and reproducibility, something that I think we can agree in this day and age is in fact much needed. So that is what I have for you. At this point, I will end and Ida is welcome back. And if there are questions, we're more than happy to field them now.
Well, thank you for that demonstration. The technical elegance of the platform is very clear. I love the fact that you have thought about composable architecture and reproducibility. But I fear that the implementation often faces significant institutional friction. So I'm going to start there. I posted a question actually about the technical interoperability. It's in the questions, and I encourage the audience also to pose any questions they might have. Can you see the question in the Q&A?
Yes. I might take a first stab. I'm sure
Yes.
JP has comments as well. From the point of view of a health system, we continually have very excited large and small companies coming to us offering, amazing technology that's going to take care of our patients and lower costs and improve outcomes and so forth. And the health center IT team is left with assessing these products and then integrating them. And often the integrations are one-off integrations that need to be maintained. They break, then the company might go out of business, might get absorbed. And that churn is incredibly expensive, incredibly challenging. And of course, many of you know that our in-house IT teams are very capacity constrained. And so this notion that health centers will purchase solutions that are on the market and invest in that kind of integration on a one-off basis, on a continuing basis is really a non-starter. And so one of the ways that we're thinking here is that, with the JupyterHealth installation, say within your firewalls, within, let's say, a UCSF firewall, that there is a pipe, right, using a Smart on FHIR connection. That is a one-time security review. And once you've got the pipe, you can push things through the pipe. And of course, there still has to be governance around the content, around the interaction with workflow, the implications on patients, and so forth. But the technical integration starts to reduce the that surface of complexity and cost and security risk. So I think it's a multifaceted problem that you're raising, Vivek, of course, but there is a technical solution to it that we've zeroed in on, and then it fits within all the other governance challenges that a health system must face.
It's very interesting. If I may ask, how does it sustain itself? JupyterHealth, is there a funding source? I ask this because the mHealth community, as you pointed out, struggles with all these devices, and then halfway through the study, they're discontinued. And that's a huge burden on these junior investigators.
Yeah.
So how do you sustain yourself? Where do you see it going?
Yeah, so JupyterHealth is a sub-project of the Jupyter Hub project of Project Jupyter. That's a lot of layers. Project Jupyter is now part of the Linux Foundation. So the Linux Foundation is the fiscal sponsor. It means that Project Jupyter is a 501c3 and a 501c6. So it is an official nonprofit organization, and as a 501c6 can also take corporate support. So this is, it's the challenge of all open source projects, how to get, sustaining funds. We are early. We have seen interest from a wide range of participants, both industry and non. Project Jupyter itself, Jupyter itself is embedded within all the major clouds. There are like billion-dollar companies that are built on and serve the Jupyter ecosystem. There is money in this. And while, JupyterHealth, of course, is true to the objectives of a nonprofit that is focused on the betterment of health and healthcare, we're not naive to think that there are partnerships that can generate sustaining funds for the open source community. JP, you want to say anything about that? You also have spent years and years in open source.
Yeah, I think that ecosystem of for-profit that exists around open source software and sort of in parallel and partnership with nonprofit space, it does offer a lot of opportunity for the betterment of of these kinds of software platforms. So, I'd have mentioned a couple of ways, but I think or additionally the kinds of things we're talking about here are straightforward things like a big company wants this platform to exist. They need to embed it in their cloud services or, et cetera. And so they use the code, they make financial contributions. That happens all the time in the open source software space. The next is big company maybe does or doesn't make the financial contribution, but they make significant engineering resource contributions because it's critical to their path forward now that they've decided to integrate these tools. That can certainly come with some challenges for the open source community. If the big guy is using tens of developers or hundreds of developers on a small project, but nevertheless, this is one way forward. And then the next is even nonprofit organizations and the like can provide services that support these kinds of tools. So one of our partner organizations that I mentioned earlier, 2i2c, is a nonprofit that provides sort of cloud support services related to Project Jupyter more generally. So there are healthcare systems out there. There are researchers out there that get grants that have money that they need to spend or would like to spend to support these kinds of endeavors. They need someone to call for technical support, someone to get mad at when things don't work, and that's a line of services that can be offered even by organizations such as ours that can fund future development in addition to just serving those additional clients.
Wonderful. Yon has his hand up.
Yeah, hi, thanks a lot. It's a very impactful platform. So I'm curious regarding the current security and privacy protections in the case that you actually get data from the patient as well. And also what kind of machine learning algorithm are currently supported by the platform?
Yeah, so I'll start and Ida can add anything she wants. So from a security perspective, the JupyterHealth Exchange will live in most circumstances within the healthcare organization's firewall. So it would get deployed somewhere internally, and all data in and out would live with the same sets of protections that are governed either by institutional policy, by IRB policy, and then potentially further by any specifics related to a study if it's a research project. The simplest way to describe some of this is that any of the security measures and protocols that exist within the domain of things like an EHR-based API or an EHR API, which is also a FHIR-based API, or any of the other kinds of clinical data repositories that you may have set up on like Azure or AWS, would extend to this. So, things are scoped based on the patient. They're scoped within, the different kinds of data that a particular patient is permitted to contribute or retrieve. And then access to those data are scoped on the level of particular care providers, research studies, and then individual practitioners. So if you're an organization with looking to sort of have the maximum level of protection, you would not allow any of the data from the exchange to ever be read by anyone outside of your organization. It could just be read by providers and by researchers. You would enable the elements of the right API that allow mobile applications that you create or that your partners have created to push data into your cloud, but of course not let them back out. So that's kind of the high level overview of the security stance here of the application. And as I mentioned earlier, it does integrate with your institutional protocols. So if you have your user ID at your institution, you should be able to log in with that, and that will govern your access. I think the last part of your question was around machine learning. So right. We're just getting started with that. So the data that are available through the exchange can certainly be combined with data from the EHR in whatever environment you like to do that kind of work. We have built a prototype MCP server for use with LLMs for, this is a little bit beyond or different from machine learning, certainly. But we do have a prototype MCP server and are working on next iterations of those to make access to the data, fit a little bit better within those particular confines. And then the last thing I'll say is our collaborator, Jessie Lynn Dunn at Duke. This is an area that she works in and has traditionally with CGM data, and is very eager to work on some of the aspects of that project as we get more live patients online feeding data through these systems.
Yeah, so I think I understand the current security scheme is actually based on existing access control policies or existing policy requirements. And now you are introducing more modern machine learning algorithm, including agents and MCPs. I think there might be additional consideration for security and privacy as well, because using this agent, like LM agents, they might be able to disclose more information than we originally thought. So I'd be curious to kind of learn a bit more and potentially collaborate. I'm an associate professor here at UCLA, in the computer science, computer engineering department, but I work a lot on the trustworthy AI especially for medical data as well. So I'll probably reach out and hope to talk more.
Wonderful. Would appreciate that.
That would really be wonderful. I want to emphasize the point that the conceptualization of JupyterHealth really is to address the full spectrum of health and healthcare. It's not just based on a health system, being able to meet its security policies, but they're just individual people. And as you raise, and I've just seen this morning that Perplexity is getting into the consumer health space, right? So it's wide open. So privacy issues, data issues, that really just even taking the healthcare system out of the picture. There's so much to do, and that is part of the JupyterHealth vision. So encourage anyone else who's also interested in this, do reach out. We are very eager to build out this community.
Yeah, thanks a lot, Ada and JP.
Wonderful.
It's great talk. Yeah.
So we have reached our time. Thank you, Ida and JP, for your continuing leadership in this space, especially Ida. You've been in this since Open Health, and we are very grateful for your efforts and leadership. Those in the audience who stayed till the end, the recording and the technical documentation will be available on the mHealth Hub in the coming days, so you can watch it asynchronously. Ida, JP, thank you again for joining us and sharing it with our community.